Inflammatory bowel disease, IBD, is a group of chronic inflammatory disorders that primarily affect the digestive tract. The two main types of IBD are Crohn's disease and ulcerative colitis. Crohn's disease. Affected areas. Crohn's disease can involve any part of the digestive tract from the mouth to the anus, but it most commonly affects the end of the small intestine, ileum, and the beginning of the colon. Inflammation. In Crohn's disease, inflammation can extend deeply into the bowel wall and may occur in a patchy, skip-like pattern. This can lead to complications such as fistulas, abnormal connections between different parts of the intestines or other organs, and strictures, narrowed sections of the intestine. Symptoms. Common symptoms include abdominal pain, diarrhea, weight loss, fatigue, and sometimes fever. Additionally, Crohn's disease can cause extraintestinal symptoms, such as joint pain, skin problems, and inflammation of the eyes. Ulcerative colitis. Affected areas. Ulcerative colitis is limited to the colon, large intestine, and rectum. Inflammation. In this condition, inflammation is usually limited to the innermost lining of the colon and rectum, forming continuous areas of ulcers and inflammation. Symptoms. Key symptoms include bloody diarrhea, abdominal pain, and a constant urge to have a bowel movement. People with ulcerative colitis may also experience fatigue and weight loss. Causes and triggers. The exact cause of IBD is not fully understood, but it is thought to involve a combination of genetic, immune system, and environmental factors. Certain triggers, such as infections or changes in the gut microbiome, may play a role in exacerbating the condition. Diagnosis of IBD involves a combination of clinical evaluation, blood tests, endoscopic procedures, such as colonoscopy or upper endoscopy, and imaging studies, such as CT scans or MRIs, to assess the extent of inflammation and rule out other conditions. There is no cure for IBD, but treatment aims to manage symptoms, induce and maintain remission, and improve quality of life. Medications. These may include anti-inflammatory drugs, immunosuppressants, biologic therapies, targeted at specific molecules involved in inflammation, and corticosteroids to control acute flare-ups. Nutrition. In some cases, nutritional therapy, including specialized diets, may be used to manage symptoms and promote healing. Surgery. In severe cases or when medications are ineffective, surgical intervention may be necessary to remove affected parts of the intestines or address complications like strictures or fistulas. IBD can lead to various complications, including malnutrition, intestinal obstructions, abscesses, perforations, and an increased risk of colorectal cancer, particularly in long-standing cases of ulcerative colitis. Individuals with IBD often need to make lifestyle adjustments to manage their condition, including dietary changes, stress management, regular exercise, and consistent medical follow-up.